Every person is at risk for cancer, but each person's risk is individual. Karla Bultman, genetic counselor with Mercy Health LAC Center, joins us today to discuss appropriate options for screening and management of breast cancer risk. Thanks so much for joining me today.
Hi, yeah, I'm glad to be here.
So I have a question with that. How does breast cancer run in families?
So most cancer actually doesn't run in families. So the vast majority of cancer is what we call sporadic, meaning that age and environmental factors are typically the biggest players. But about 5 to 10% of cancer does actually run in families. So this is when there's a single underlying genetic cause. It's what we call hereditary cancer. And this problem with a cancer gene can increase the risk for developing cancer. We can see that gene mutation in different family members. And so we typically want to test for that and try to identify what the risk is for those family members if they carry that genetic mutation.
So is that an overview of what you basically do as a genetic counselor?
So that's a really good question. So that is certainly a part of what I do. I do talk with people kind of about their family histories. That's the biggest portion of our session really, is we get in depth with the family history, ask people who's had cancer, what ages they were diagnosed. We talk about whether or not there could be a hereditary cause and whether we want to do genetic testing to potentially identify that cause.
So some people are at risk more so than others. For those people, what are some good risk assessment management options for them?
So as you mentioned, everyone's at risk for cancer. So there are normally recommendations like mammograms at 40 for women, getting colonoscopies when you turn age 50. But when we have individuals who are at high risk for cancer, specifically if we're talking about hereditary breast or hereditary ovarian cancer, which kind of go together, then we start screening at much younger ages. So oftentimes in the mid-20s, and we do frequent screening. So often doing it not just every year, but maybe every 6 months. We also may talk about preventative surgery options for some women, so taking off the breasts preventatively or removing the ovaries or uterus preventatively as well to reduce cancer risks.
Great. So some people might wonder, why should I go to a genetic counselor?
Sure.
It's a newer thing to me, at least, hearing about. So why should we go?
Sure. So, I'm a specially trained healthcare provider. I have special training just in the area of genetics and also in counseling to kind of translate these complex ideas into more manageable personal terms to help understand what's happening. And I really have a lot of experience in collecting that family history, which, you fill out paperwork oftentimes at your doctor's office asking for family history. But in my case, we really delve into it in detail, and I can give information then about what that family history actually means. I'm also able to translate the genetic testing results. So understanding what does it mean if you come back positive, but also what does it mean if we get a negative result? So, does that mean that I'm not at risk, or am I somewhere in between in that situation?
Right, so you just walk them through that whole line.
Absolutely.
And so should everybody go see a genetic counselor, are we thinking, or just those at very, very high risk?
Sure, that's a really good question. So really not everyone is appropriate to go have genetic counseling. That would be a lot of patients for me to see.
Right.
The people that are most appropriate typically are individuals who have what I would consider a strong family history of cancer. So 3 or more people oftentimes with cancer in the family, diagnosed maybe at young ages, so under 50. If we see certain rare cancers popping up, like ovarian cancer, maybe pancreatic cancer, those may be red flags for me. And then if we see generations developing cancer, so where we've seen maybe grandma and mom and now a daughter developing breast cancer, that can really be a big sign for me as well.
Great. Well, thank you so much for joining me today and talking about this very complex and important topic.
Absolutely.
I appreciate it. If you would like to learn more about Mercy Health, Comprehensive Breast Center, you can figure out more on our website. We've got the link for you at wzzm13.com.